Hello, and welcome to LMTV Spotlight. LMTV Spotlight shines a light on the people, places, and organizations that help make Lower Merion what it is today. Today, we're going to look at the Mainline Veterinary Integrative Practice, or Mainline VIP. Joining me today is Dr. Deborah Aronson of the Mainline VIP. Welcome, and thank you for joining me today.
Thank you for having me.
You're welcome. So if you could tell me a little bit more about what Mainline VIP is and what it does.
Sure. So Mainline VIP is an in-home only veterinary practice. So I only do house calls.
Okay.
And the practice is limited to palliative care, hospice, and end-of-life care or euthanasia for companion animals.
Very interesting. Okay, so you don't have a physical location then, correct?
Correct. Yeah, I only go into people's homes.
Okay, and do you have specific hours that I guess normal working hours, or how does that work?
Typically normal working hours, especially for my palliative patients or my acupuncture patients.
Okay.
End of life visits, I try to maintain a little bit more flexibility and can occasionally help people evenings or weekends.
Who can use Mainline VIP? Is it only people that live on the Mainline?
No, not at all. I'm based in Lower Merion, and so that's how I chose the name. But I do try to stay within a certain driving distance.
Okay.
Yeah.
How did Mainline VIP come to be? Like, when did it start? Can you tell us a little bit more about that, please?
Sure.
Thank you.
So I've been in regular primary care veterinary medicine at a regular clinic since graduating from vet school back in 2001. But then I started an in-home end-of-life service in 2008 that was called Final Blessings. In 2014, I got my certification in veterinary medical acupuncture, and that's when I founded Mainline VIP.
So what exactly is medical acupuncture for a pet?
Well, it's acupuncture.
Right.
There are 3 certifying bodies in the United States for veterinarians, okay. And 2 of them follow more of a Chinese or Eastern medicine. The one that I practiced followed Western medicine, and so in my hands I tend to use it a lot for arthritis pain or neurologic problems.
That's really interesting. So you go to someone's house of an animal that's having these issues and you perform the acupuncture there in the house.
Yeah, yeah.
Wow, that's really interesting. So is it any type of animal that you service, or is it just mostly dogs and cats? Like, can somebody call you with for a bird, or even if they have a farm and they have horses and goats? And like,
well, it is mostly dogs and cats. Okay. I can see some other animals. There's not too many, dogs and cows and goats cows and goats and horses close to the main line or where I am. So I have other colleagues I can refer out for that.
If somebody needed that kind of thing.
Yeah, but acupuncture for horses is actually quite popular.
Interesting. What about like special types of pets, like lizards or gerbils or things like that?
I can see them for end of life visits, but I'm not too comfortable doing acupuncture. It's difficult in a lizard.
Right. So I'm very interested because I've never encountered a vet that provides the services you provide. So can you extrapolate a little bit more on exactly the type of end-of-life care and like how that whole process works? If somebody's interested in your services and they've never used you before, what do they have to do? What's the process?
Sure. So the best thing for them to do would be to go to my website. I have a lot of information on there about what to expect during the procedure and or during the visit, as well as preparing for afterwards, such as cremation options, that kind of thing. I have prices on there, and importantly, I have an intake form, which gathers all the information I need in order to schedule an appointment. Okay. In addition to the in-home, I also want to mention I do virtual consults.
Oh, okay.
So if someone is struggling with the decision, they're not quite sure that it's time, they're not ready for me to come out, I can just speak with them, spend some time talking with them and working through the decision and helping process what's going on.
So sad. Yeah. Do you have other people that work for you, or is it just you?
I have someone who can help me with some of the communication, but I'm the only one who does the house calls. I'm the only veterinarian on staff.
Okay, so if a pet has to go into hospice care, right, I'm assuming it's similar to a person, whereas it could be a couple days, it could be a couple weeks, right? So how do you get them through that? Like, you know, when someone has hospice care, they have someone that comes into the house on a daily basis or whatever. Is that, do you do that as well, or how does that work?
Well, I don't come into their home on a daily basis. I can refer, there are some veterinary technicians who can help with that kind of work. Most of my patients do have a primary care veterinarian. So I don't do routine care in the home. I don't do blood work or x-rays or that kind of thing. And so I work with their own veterinarian to basically make sure that my patient is comfortable, you know, is eating, is drinking, is comfortable, doesn't have any pain, that kind of thing. Some of my palliative patients, I help them for years. You know, maybe they've gotten a terminal diagnosis.
Right.
Others, I might visit them just once. So it's very hard to predict.
Okay. But you basically are there holding their hand and helping them know when.
Yeah.
And then you mentioned euthanasia. I know what that is, but what can you say a little bit more about that and how, you know if that's the right option? Well,
that can be very, very, very difficult for people to figure that out. It's, you know, it's a tough decision. Sometimes it's obvious. You know, if there's a traumatic situation, for example, it's very obvious. Sometimes, you know, we all kind of hope that our pet will pass in their sleep and we won't have to make that decision at all.
Yeah.
And so that's where it gets complicated. And then there's a lot of factors. Certainly pain is a big one, and that's the most common concern that owners, you know, bring to me. But there are other concerns as well, and it's not just pain. It's suffering can come in all forms. There's physical suffering, there's emotional suffering of the animal as well as their caretaker, their family.
Yeah, because they become part of the family. So, you know, you actually kind of become part of the family because you help them through such a hard time. In your line of work, what do you think is like one of the most common things that you encounter?
Well, because I'm dealing with kind of two populations of patients, with my acupuncture patients or my palliative patients, it tends to be arthritis. You know, they tend to be a little bit older, and so, you know, difficulty getting around, difficulty getting up, that kind of thing is the most common situation.
So the acupuncture is not necessarily an end-of-life treatment. It's just to make them more comfortable.
Yeah, and so so for the acupuncture, I'll do acupuncture on a post-op patient. So a dog that has had a disc surgery, you know, surgery for a prolapsed disc, for example, and is nowhere near end of life, acupuncture can help them regain function.
Wow.
Yeah, so it's a little bit separate.
Right. So I'm sure pets are similar to people in that their reaction to needles with acupuncture can be a little off. How have you found that experience, and what do you do to calm their nerves?
Sure. Calm their nerves.
No pun intended.
No pun intended. It varies. Most animals tolerate acupuncture really well. But, you know, sometimes they need a little bit of a distraction. The acupuncture needles themselves are very, very teeny tiny, and for the most part, they don't even notice them.
Okay, that's good.
But sometimes they can be a little uncomfortable, and so then we can use distractions like treats or petting them. If it comes to the point where an animal just really, you know, doesn't appreciate the needles at all and wants to run away or whatever, I also have a cold laser. Which I can use, which provides some stimulation similar to the needles without the same discomfort. And so I can use that as an alternative. I also do medical massage and myofascial palpation and release.
So if you have a pet that's terrified of needles, there is hope?
There is hope, but there are also veterinarians who do acupunctures in the clinic where they would have an assistant who can help them if it comes to that.
Okay.
I can refer.
Okay, that's always good.
Yeah.
And then one of the last things I want to ask you about before we have to go to commercial is the benefits of euthanasia in the home.
Yeah. So this is something that it's a growing field, and I started offering in-home euthanasias after euthanizing my own cat. And I didn't even think to bring him to the clinic because I knew it would really stress him out, and then that would stress me out.
Right.
And I understand not everyone would want this to happen in their home, but it can be less distressing to the animal to be brought out of their home environment.
Yeah, definitely.
They can stay where they're comfortable, they can stay where they're safe and secure, and it's private. Whoever wants to be there can be present. That was especially important during COVID, for example.
Definitely, yeah.
And the techniques I use are designed to keep a difficult situation as calm and as dignified as possible.
That's good, because pets always feel most comfortable in their home, right? So this helps to make it easier.
Yeah.
I'm really enjoying our conversation, but sadly we have to go to commercial. Thank you so much for watching. We'll be right back. Welcome back to LMTV Spotlight. I'm Jamie Snyder, and I am here with Dr. Deborah Aronson of the Mainline Veterinary Integrative Practice, or Mainline VIP. So, before we get back into the animal stuff, I'd like to hear a little bit more about you. Where did you grow up? Where did you go to school? What can you tell us?
Sure. Well, I'm actually a Lower Merion local. I grew up near General Wayne Park, and I went to Solomon Schechter and Akiba. Yeah, and then I went away for college, came back to go to University of Pennsylvania Veterinary School.
Okay.
Moved away again, and then came back in 2008.
So what got you interested in animals? Is it something you've always been interested in? Or?
I've always been interested in animals. I was actually a kennel worker at the Narberth Animal Hospital in high school. But I didn't want to be a veterinarian until I was well into college. And when I made the decision that I did want to go to veterinary school, everyone who knew me said, of course you're going to be a vet.
So it was something that's not a new passion, something that you knew from, you know, a long time ago, basically. And you said you went to University of Pennsylvania.
For veterinary school.
For veterinary school, okay. So I think we all realize the importance of your job and veterinary medicine in general. Do you have any tips or tricks for people who are pet owners, like getting ticks out or chocolate toxicity, anything like that?
Sure. Well, I actually have recently started teaching a basic pet first aid class through Mainline School Night.
That is so cool.
Yes, and one of the things that I wanted to mention tonight or today was chocolate toxicity. Okay. So the active toxic ingredient in chocolate is something called theobromine, and it converts to caffeine when we're talking about dogs here, primarily, when they eat it. Okay. The amount of theobromine in chocolate actually varies with what type of chocolate it is. So white chocolate has the least amount of theobromine in it, and it's all related to the amount of cocoa powder, pure cocoa powder in the chocolate itself. So that goes white chocolate, then milk chocolate, then dark chocolate, semi-sweet, and baker's chocolate. And we actually have calculators where we enter in the type of chocolate, the amount of that chocolate that the dog ate, and the weight of the dog to figure out if it's going to cause a problem. So for example, 1 ounce of milk chocolate in an average 40-pound dog, probably they'll be fine. They might have a little bit of stomach upset. Maybe they'll get a little bit agitated, but they'll probably be fine. That same 1 ounce square of baker's chocolate in that same dog could actually be fatal.
Oof, okay.
And so, while I never recommend giving any chocolate to
bottom
any
line is
dog,
just
just don't do it. If your pet gets into chocolate, it's actually very important to know what kind of chocolate it was and how much they ate in grams or ounces, as well as how much your pet weighs. Because when you speak with a veterinarian about it, they can actually enter those into that calculator and figure out if this is a problem or not. And if it is a problem, it's very important to get them in immediately, to induce vomiting, and to give them supportive care and something called activated charcoal to prevent absorption so that they don't become too ill from it.
What a mess.
Yeah.
So say it's 11 o'clock at night and you're munching on chocolate and your dog gets some of it. Do you recommend going straight to a pet, like 24-hour pet place, or what do you do at that time?
Well, what I usually recommend, because there are so many things that dogs and cats can get into, from chocolate to different plants to different medications in the home.
There's so many things.
So many things.
Aside from favorite socks too, right?
Well, yeah. But there are actually 2 different animal-specific pet poison hotlines.
Oh, that's great to know.
Yeah, they're 24/7. There is a fee to use them, but if an owner, calls, calls, and then a case is created, they'll get a case number, and if they then have to go, take their pet to the veterinary hospital, the veterinarian can get that case number and consult with the toxicologist to know exactly what needs to be done, if there's a particular antidote or treatment to prevent further problems.
Brilliant.
Yeah.
I had no idea, and I'm a pet owner, so
oh yeah,
this is so great to know. Yeah. Also, what about removing a tick? I mean, I know for me, I'm terrified. If I see a tick on my dog, I would, first of all, I probably wouldn't even notice it, but I would just have no idea what to do.
Yeah.
So I know that, you don't see pets in an actual veterinary facility, but I'm sure you have experienced ticks on pets multiple times.
Oh yes, okay. Yes. I've removed many ticks, and I still do, even in the home. So, ticks in this area are plentiful, especially during the fall or the spring seasons. You can apply a tick preventive. There are oral ones, there's spot-ons, there's collars, that kind of thing.
Like NexGard or Frontline, right? Those
are 2 examples.
Okay.
And there's a collar for dogs, not for cats.
Okay.
Ticks in this area do carry certain diseases, such as Lyme,
right,
which most people have heard of. It takes them almost 24 hours to transmit the disease, though. And so if your dog or cat gets a tick, if you remove it quickly, you can actually prevent transmission of that disease. And so one thing you can do when they come inside is use a fine-tooth comb, like a flea comb, to comb them, to find any ticks that might have been crawling in the fur but not attached yet.
Right.
If you do see a tick that's attached, use a tweezers to grip the tick very close to where it's attached to the skin. Don't twist it, or because it might disconnect from the mouth parts.
Okay.
Just pull it straight up. And if there's any mouth parts that stay in, if you can't remove them, just leave them there. The area will scab up, and the mouth parts will eventually come out, work their way out, kind of like a little splinter.
Wow.
And then if you're concerned, you can call your veterinarian.
Right.
Yeah.
So I was thinking more about the chocolate toxicity thing.
Yeah.
Does that apply to cats too? I mean, I don't think cats eat. I mean, I guess they pick stuff up off the ground as well, but do cats experience that like dogs do?
They can, but they tend not to. It's just not as common.
So if your cat gets into chocolate, you should still call, but not be as concerned as if it's a dog.
Yes,
okay.
Exactly.
The other thing I'm fascinated about, you mentioned briefly, is the pet first aid that you teach. Okay, so say somebody wants to learn that. How do they, is that information on your website, or how do they take one of your classes? I would love to do it with my, do they bring their pet?
No, no pets come to the class.
Okay.
I've started teaching it through Mainline School Night. I also am planning to teach at Haverford Adult Ed, and also at some other spaces in the area. If anyone's interested in bringing it to their community, they could certainly reach out to me via my website and ask.
Yeah.
There are some good online resources for pet first aid as well. The AVMA, the American Veterinary Medical Association, has some good information, including a a checklist for a first aid kit, which is something I include as a handout.
That's so cool.
Yeah.
So if someone is interested in finding out when you are teaching another one, they can always email you or call you and find out where you're going to be teaching next, right?
Yeah.
Okay. Does that also include CPR, the first aid for pets, or that's a whole different ballgame?
I include it to be complete, but the truth is, if you have to do CPR on a pet, it's probably not going to end well, unfortunately.
Right. I mean, you
Yeah.
definitely don't want to get to that point, right?
Yeah.
And so just to review, you don't have a physical location, correct? Just to remind everybody. And so if they want to get in touch with you, it's phone or email or website, correct?
Yeah, the website is best.
Okay.
Especially if they're interested in making an appointment. If they email or phone, we'll be directing them to the website, to the intake form anyway.
Okay. And I know that what you do is incredibly unique, and it's, you know, so grateful to have something like this. But if you could give me a little bit of a public service announcement on Mainline VIP, right? If I'm new to the area and I'm experiencing, you know, I have a pet that's getting close to the end of life. Can you sell me on why we should choose you, and, you know, give me a little bit of a PSA as to why we should choose Mainline VIP?
Sure. You know, if you have a furry friend that's been diagnosed with a terminal illness or is starting to decline at home, you know, part of the agreement when we take these animals into our lives is we understand that most of the time we will outlive them.
Yes.
And getting prepared for that as best as you can help the process go a little bit easier and a little bit smoother. I get a lot of referrals from the local veterinary hospitals in the area for clients that need a little bit more hand-holding.
Yeah.
And that's what I'm happy to provide.
That would definitely be me.
Yeah.
So any final thoughts? Is there anything that we didn't cover that you want to talk about what you do, or, you know, anything pet related in general?
I feel like we've covered most of it.
Okay. So yeah. So if you get to that point with your pet, choose Mainline VIP, basically, right? Well, thank you so much for joining me today. I've completely and totally enjoyed our conversation.
Thank you.
Sadly, we're out of time for this edition of Spotlight. I'd like to thank Dr. Deborah Aronson of the Mainline Veterinary Integrative Practice for being with me today and giving us a look into a valuable service in our community. If you want more information on Mainline VIP, check out their website at mainlinevip.weebly.com. And I want to thank you for watching. I'm Jamie Snyder. I'll see you next time on LMTV Spotlight. Have a great day.